A Jackson-Pratt drain is a closed-suction medical device that is commonly used as a post-operative drain for collecting bodily fluids from surgical sites. Each drain comes with a clip to allow you to secure it to your compression garment. Please empty the drains whenever you notice they are full. You may empty the drain into the toilet. If the drain bulb appears inflated, almost like a grenade, this means it has no suction. Make sure to squeeze all the air out before you plug the bulb. When done correctly, the bulb will have a deflated look. For patients that have multiple drains in place, it is not uncommon for one drain to be more active than the other. In the case you feel one drain may be clogged, we recommend milking the drain twice a day to help pass any clot stuck in the tube. Starting at the drain insertion site, pinch the tubing close to where it goes into your skin. Using your opposite hand, pinch below your other hand using your thumb and pointer finger, sliding the fingers down 2 to 3 inches. Keeping your fingers pinched, continue to slide them down the tubing. Keep doing this until any clots are out of the tubing and into the bulb. In the case your drain was accidentally pulled and is no longer able to hold suction, please contact the office during regular hours so we can schedule you to have it removed.